Welcome to 2-Minute Anaesthesia in Critical Care. Today we're going to discuss antifungal agents with reference to definitions, classifications, risk factors, the composition of the fungal cell wall, and the classification of antifungal agents. Antifungal agents are substances that directly act selectively against fungal pathogens in the treatment of fungal infections. Fungal infections can be classified in different ways, firstly from their appearance via microscopy or clinically. Clinical infections can be via the primary infection versus opportunistic infections. Primary infections usually result from inhalation of fungal spores, which can result in a localized pneumonia. Examples include histoplasmosis and also blastomycosis. Primary infections can move systemically, an example of which would be cryptococcus causing meningitis, in addition to progressive disseminated histoplasmosis, which usually involves the reticular endothelial system, i.e. liver, spleen and bone marrow. Opportunistic infections include Candida and aspergillosis. Fungal infections can be challenging to manage due to the delay in diagnosis leading to a higher mortality, differentiating colonization versus active infection, but also the risk of direct host tissue destruction. Risk factors are broad and based into 4 different groups. Antibiotic related due to the use of broad spectrum antibiotics. Risk factors for immunosuppression, examples include HIV, malignancy, chemotherapy agents, transplants, burns and liver disease. In addition to underlying infections from COPD, bronchiectasis and intra-abdominal contamination. Lines are widely used in intensive care and therefore risk factors including central lines, catheters and peritoneal dialysis lines. The diagnosis of fungal infections is complex and varies based on the species. The basic principles are discussed below. Culture microscopy of blood, sputum, urine, CSF and also lines. Imaging of body compartments, which usually involve CT. And specific tests involving serology. Beta-D-glucan is an important component of fungal cell walls and therefore is raised in infections involving Candida, Aspergillus and Pneumocystis. However, this is not the case for cryptococcus or blastomycosis. Galactomannan assays are widely used for diagnosis of invasive pulmonary aspergillosis. It's an antigen-based assay of polysaccharides in the cell wall component, in addition to molecular analysis via PCR. Fungal cells are composed mainly of a rigid cell wall, which is 3 layers, and a cell membrane. The cell membrane is slightly different as it contains the steroid ergosterol, which replaces cholesterol in the animal cell membrane. The innermost layer of the cell wall is relatively conserved, whilst the remaining layers can vary between different species. The first, most rigid layer of the cell wall is a chitin. This is a polymer of N-acetylglucosamine, which is an amide derivative of glucose. Next, we'll have the beta-glucan layer. This is the main component of the cell wall, forming a link between the inner rigid layer and the outer flexible layer. They're composed of long chains of glucose molecules linked to each other via glucosic bonds. And finally, they have the glycoprotein layer, composed mainly of the mannose and can be involved in cell wall synthesis and breakdown. Antifungals have a broad range of actions. However, there's significant focus on the components involving the cell membrane and wall. Broadly speaking, there are 5 basic groups. Firstly, the polyenes, which includes amphotericin B and nystatin. These are macrolide antibiotics that bind to ergosterol in the cell membrane, thus forming pores, leading to the release of electrolytes and small molecules. Secondly, we've got the azoles, with 2 subdivisions, the imidazole and triols. These involve a selection of antifungal agents including fluconazole, miconazole and voriconazole. Once again, they prevent ergosterol formation by inhibiting fungal cytochrome P450s, leading to increased permeability and therefore release of cellular contents. The allianamines includes terbinafine, which also prevents the formation of ergosterol by inhibiting sequelin epoxidase. Fourthly, we've got the echocardins, which includes caspofungin. These inhibit synthesis of beta-glucan in the fungal cell wall by inhibiting the enzyme 1,3-beta-glucan synthase. And finally, the other group, which includes greasephulvin. This has fungostatic action by inhibiting microtubule assembly in fungal cells. Once again, thank you for watching.